Good evening. Today I'm going to talk about a clinical presentation. So it's a female patient, age 32, weight 50.6 kilograms, but the usual weight of this patient is 61. The ideal weight for her is 65.6, and the BMI is a little low. It's 17.4. The normal BMI is 18 to 25. Her height is 175 centimeters. So the patient reports a 3 month history of abdominal distension, poor appetite, and she lost 16 pounds weight loss. It has nausea, pain, and upset stomach, vomiting, and stuff. Patient was recently visited a remote village because she lives in Mexico. She's an anthropologist. So she was diagnosed with gastritis and given antacids, which did not provide any relief. After 4 to 5 days ago, she started to develop headaches, cough, diarrhea, fever, night sweats, and rash on her legs, a general malaise. Patient had resource to fly in her private jet to a major medical center in Texas, where she was diagnosed. She was diagnosed with a lot of stuff, and her health quickly deteriorated. And she developed hypotension and pulmonary edema. This patient required to be intubated and placed on a mechanical ventilation. She was in the ICU, that is the intensive care unit. The patient was under nasogastric tube, and she was placed for a TPN, total parenteral nutrition. Patient was brought to surgery for exploratory laparotomy, where approximately 100 centimeters of the proximal portion of the jejunum was found to be necrotic. It wasn't functioned correctly. Um, and it was found as Gary's roundworm leg, ranged from 12 to 38 centimeters leg and from 3 to 7 millimeter. And the duodenum, which had the consistency of noodles, so it has to be removed because it, it we can't do anything. Well, the doctor can't do anything about it. So the assessment for this patient was that the entire duodenum was removed, measuring a 22 centimeters as well as 100 centimeters of the proximal portion of the genome. And after this surgery, we found on the labs that she has a vitamin D and B12 deficiency. She has an acute pancreatitis, and she has a Crohn's disease diagnosed in her early 20s. It makes it a little harder to evaluate, to give her an evaluation. Patient is under a strict vegan diet where she doesn't cook, so she doesn't have idea what they cook. Put in her food, I mean, if they wash correctly the fruit and all stuff, and the index of fiber was really high when she's supposed to drink that amount. So we can see here the lab results. I highlighted on green which one are most of them in the limit or the minimum requirement, and the yellow, it's they are a little bit high of the normal reference value. The red ones are the ones that are super high, or in this case, yeah, most of them are in high. And the blue, it means that the values are low, or really below of the normal range. So having this lab test, I create a formula. The diagnosis is that the 32 female patient developed hypotension and pulmonary edema. Patient is under a mechanical ventilation. Patient had a parenteral nutrition, that's TPN. Patient was found with a scarred around the duodenum, losing weight, nauseous, and vomiting. That's why it has to be removed. TPN was discontinued after the PEG was placed and then removed because patient did not present dysphagia. Patient needs to increase the adequate intake of protein because she has a malnutrition. She's underweight, so she needs to change her diet. My intervention, I did a renal formula, where the renal formula required 1770 1770 kilocalories, that it's 1.8, 81 grams of protein, 160 grams of carbs, 96 grams of lipids, and 727 milliliters free water per liter. So I put the formula, the patient weight, I put the current weight, that it is 53.6, and because she's underweight, I put a minimum and a maximum requirement of kilocalories of 25 to 30. It gives us a minimum of 1,340 to 1,608 kilocalories per kilogram per day, and the protein, because the potassium is high, I will say that I will put 1 to 1.2 protein per kilogram. And this is why I put the renal formula, because during my research they recommend that if the potassium is low or high in the lab results, it's better to use the renal formula than the standard ones. So that's why I picked this formula. And well, the protein gives us a minimum of 53.6 to 64.32, and the starting goal uh, will be 1,340 kilocalories to 53.6 grams protein. Protein, I'm sorry. So here's all the formula that I did. So I I I put the kilocalories by 1 milliliters. It gives me 31 milliliters per hour, and the result of the milliliters, it has to change to liters. That's why I have here here the 0.74 liters. And with this result, I can get the proteins, the carbs, and the lipid requirement per day, and it gave me 59.94 grams protein per day. That's the one I'm going to have. 118.4 grams carbs and 6.66 lipids. And the water, and the flush water will be will be 537.98 milliliters flush water and free water, I'm sorry. And this I will put, I distributed all this free water every 4 hours. So it will be 134 milliliters every 4 hours. So the tube feeding that I choose was Vital AF 1.2 kilograms. So this is for a long or short-term patients, and this is because the patient experienced malabsorption after, because she has a Crohn's disease and it has a well, the duodenum was removed, so she will present malabsorption, sometimes indigestion. She was presenting indigestion, so this is why I choose this tube feeding. The tube feeding is a medium chain triglyceride, and it's really well absorbed and the absorption of fatty acids. It has prebiotics, so fibers that stimulate the growth of beneficial bacteria in the colon. Um, it will help her to modulate inflammation and support the function. It gives you the bottle 75 grams protein with the increased protein needed for a stress patient. So these calculations that I did 1 to 1.2 grams per kilogram. So this one will be excellent to start support the healing to the patient. The kilocalories, it's 1,500 calories. So we start with 1,300 something calories, but the main goal is goes up to 1,600 calories. So it will give you a better results to start using the Vital AF. And the Vital AF, um, it helps to increase the vitamin D, so that will help the patient to recover. And it helps even to elevate the levels of antioxidants like vitamin C and E, so that way we can reduce the free radical damage. It's gluten free, and sometimes when you suffer GI intolerance or you have a duodenum surgery or Crohn's disease, so the time you will develop lactose intolerance. That's why I keep with the Vital AF. So that's my presentation. Thank you so